Hello dear learners, myself Bhavani Pentela, working as an assistant professor in Noida Institute of Engineering and Technology, Pharmacy Institute, Greater Noida. In this lecture 16, we are going to discuss about dose response relationship, therapeutic index and combined effect of drugs, which include in the second unit of a subject Pharmacology-I with a subject code BP404T. So, without any further delay, we will dive into the class. So, what is any dose response relationship? So, before going to the dose response relationship, we will discuss about what is any dose and what is any response and what is the relationship between the dose response. Okay. So, if you split the terminology here, so what is any dose? So, you can easily say what is any dose? Dose, it is an amount of a drug administered to a particular person or a particular patient in which you are going to treat, right. What is any dose? Dose is any particular amount of any drug we are going to administer to the person. And what is any response here? So, after administering a particular drug and what the effect or what the response is shown by the drug is called the response. So, dose, if I am talking about the dose, I can give a best example here if I am taking the paracetamol. So, the paracetamol is available in a doses like 200 mg, 500 mg, 650 mg. So, what the dose you are giving here, if I am talking about the 500 mg of paracetamol, here what the dose it is, 500 mg is in a dose. If I am talking about the 650 mg of a paracetamol, 650, Dolo 650. So, you can hear the medicine name like Dolo 650, Dolo 500. So, what is the dose here? 500, Dolo 500, the dose was 500 and Dolo 650, the dose was 650. So, amount of a drug administered to the particular person is called as a dose, and the what dose you are giving to the particular person, if it showing any effect or response, then you can call as a response. Okay. And for example, response. So, here you can say that I am giving the paracetamol tablet to the particular person to treat the fever. So, what the response have to shown with the drug? The response have been the response we will expect from the drug, it have to reduce the fever, right. So, what the drug it is? The paracetamol is an antipyretic drug. It is an antipyretic drug which falls under antipyretic classification, and it have to decreases the fever. What the response will be seen by the drug? It have to decrease the fever. And what the dose you are taking here? 500 mg of a paracetamol. So, what is a dose response relationship? So, if I am talking about the relationship used to analyze a kind of a response obtained after administration of a specific dose of a drug. So, what the relationship meant here? The relationship here, the relationship used to analyze and what kind of response will be seen after administration of a particular dose. So, you had administered the particular dose to a particular person, and what response you had been seen. To analyze this, you can call as a dose response relationship. So, here I can give an example which you can call as an ilaprazole. So, what drug it is? It is a proton pump inhibitor which is used in the peptic ulcer, which is used to decrease the gastric acid secretion. So, how much dose I am giving the ilaprazole? I am giving in a 10 mg dose. So, which dose I am giving here? I am giving the 10 mg dose of ilaprazole. Which type of drug it is? It is a proton pump inhibitor which is used to treat the peptic ulcer, right. So, the dose was 10 mg. So, what is the relationship between here dose with the response? Here I am taking the dose 10 mg to treat the peptic ulcer. Which drug I am taking here? Ilaprazole. Within the particular 10 mg, specifically 10 mg, it have to block the proton pump it have to block the proton pump, because the proton pump is responsible to secrete the gastric acid secretion. By blocking of this proton pump, it can act as an anti-ulcer drug. So, ilaprazole, what response it have to show? The response was a proton pump inhibitor. It have to reduce the gastric acid secretion. And how it have to reduce the gastric acid secretion? Within this 10 mg. So, I think dear learners, you can get clear with this dose, response and relationship. The dose, it means how much amount you had been administered, response, what the response you have been seen after administration of any drug, and what is the relationship to analyze after administration of drug to its response. And if you are taking the ilaprazole, it have to specifically, it have to inhibit the proton pump within 10 mg. And next we will discuss about the dose response curve. So, what is a dose response curve? Give the relationship dose to its response, if you are illustrating in a graph, then you can call it as a dose response curve. So, if you are illustrating this response or this dose to the response in a graph, then you can call it as a dose response curve. So, generally the dose response curve intensity will get increased as the dose increases. For example, if I am increasing the dose of a particular drug, obviously the response of a particular drug also will get increased. If I am giving the 200 mg of an paracetamol, it can show the antipyretic effect. If I am giving the 500 mg, the dose increases, the response also will get increased. If I had increased a certain amount of a drug like 650, so 650 of paracetamol, it can decreases the fever, right. So, as the dose increases, if I am talking about the histamine, at the low dose, even it can causes the contraction. As the dose increases, the contractions also will get increased. The intensity of an response will be get increased as the dose get increased. So, here the dose response curve is a regular hyperbola. Why it is a regular hyperbola? Because it will obey the law of mass action. Because it will obey the laws of mass action, so the curve is a regular hyperbola. If I am taking, so look at here, so this is a graph. So, if the relationship of a dose to its response, if I am illustrating in a graph, then it is called as a dose response curve. Here on x axis I am taking the dose, on y axis I am taking the response. Okay. So, if I am illustrating, if I am plotting the graph, as the dose increases, the response also will get increased, right, and this is a dose. If I am doing the log dose, it will be like this. This is a log dose. So, this is the curve, the dose response curve is a regular hyperbola, because it will obey the mass action. So, if see here formula, E is equal to E max into D by Kd plus D. So, what is an E here? Absorbed effect of any drug. So, what you are going to absorb? What you are going to absorb the dose of any drug? It is an E here. What is E max? Maximum response of any drug. The maximum response produced by the drug is called E max. What is the D here? The D represents drug or dose. Okay. And what is Kd? The Kd represents like dissociation constant, and what the D represents the dose or the drug. So, E is equal to the effect that absorbed by the drug is equal to maximum response into dose or drug by dissociation constant plus drug. Okay. And if you see the below of any dose, you cannot see any adverse drug reaction. So, this type of reaction you can call this type of if there is no adverse drug reaction to any particular chemical, then you can call it as a threshold. Okay. So, next we had, so if I am talking about the dose response curve, it has been divided into two types. The dose response curve has been divided into two types. One is graded and second one is quantal. The graded response curve you can call as a quantitative response curve, and quantal response curve you can call as an all or none. Okay. If you are talking about these two types of dose response curve, we will discuss one by one here. Graded, the name itself indicating what is a graded. As the dose increases, if you are increasing a little bit dose, the response also will be get increased. If I am increasing little more, the response also will be get increased. For example, if I have taken the dose, for example, here I have taken the 1 mg of any histamine, the response will be like this, and here I had increased it to the 2 mg. The response also will be, not usually we will take in the mg, you can take in micrograms also, right. As the dose increases, the response also will get increased. But at particular point of time, the response cannot be increased, which you can call as a ceiling effect. There is no further increase in response as the dose will be get increased. Why there is no response with the increase in dose? Because the receptors has been saturated. The how much receptors are present on the particular muscle has been occupied with the drug, and there is no further receptor for the drug to bind to its receptor. So, this is the reason as the dose initially it will shows its response, but as the dose increases, the response also will get increased, but further increase in dose it cannot shows any increase in response, which you can call as a ceiling effect. And second type of dose response curve was all or none response. So, here you can see the effect, the drug effect is either present or either it can be absent. So, this is the reason why you can call as all or none response. Here I can give an example like a insulin induced hypoglycemic convulsions effect. So, if you are giving the insulin to the animal, it will induces the hypoglycemic convulsions effect, and these hypoglycemic convulsions effects it can be present or it can be absent. And the second example was a cardiac arrest with the digitalis. So, when you had administered that, when you are giving the dose of a digitalis, you can see the cardiac arrest or you cannot see the cardiac arrest. So, this is called the quantal response. And next we will move to the therapeutic index. So, what is a therapeutic index? It is a similar relationship between the toxic dose and therapeutic dose. What is a therapeutic index? Here we will give a relationship between the toxic dose to the therapeutic dose. So, now we will move to the definition. What is a therapeutic index? The therapeutic index, which in shortly you can call as TI. And what it defines here, the therapeutic index of a drug, it is a ratio. What to what? It is a ratio that the effect that produces the toxicity effect of a drug. So, what is a ratio? It is a ratio to the dose that produces, at what dose the drug is going to produce the toxic effect, and the what dose the drug is going to produce the therapeutic effect. Then between these ratio you can get the therapeutic index. So, I am repeating one more time, the therapeutic index is the therapeutic index is the drug, the ratio, the dose that produces the toxicity to the dose that produces the therapeutic effect. So, which you can call as an LD50 and ED50. Okay. ED50 means effective dose, LD50 it means lethal dose, which you can call as median lethal dose or median effective dose. Okay. So, here therapeutic index is equal to LD50 by ED50. So, it is a ratio. So, therapeutic index is a ratio. What to what? It is a ratio, the dose that produces the toxic effect to the dose that produces the therapeutic effect. So, let me see what about the LD50 and ED50. So, LD50, which you can call as a lethal which you can call as a median lethal dose, which is expected to cause the mortality in 50% of a population. So, if it producing the 50% of population toxicity, then you can call as an LD50. And what about the ED50? If the drug is going to produce the desired effect in a 50% of population, then you can call as an ED50. So, here I had given a formula of therapeutic index. The therapeutic index is equal to LD50, which you can call as any median toxic dose, and ED50, which you can call as any median effective dose. Here I had given with an example like salbutamol. So, here you can take the drug salbutamol. What the drug it is? Salbutamol is used in a asthmatic condition. It is an anti-asthmatic drug, right? So, here the salbutamol, when you had administered the salbutamol, it can shows the toxic effect like tachycardia. So, what you have to observe here is 50%. How much you have to observe this tachycardia in the 50% of population to the desired effect to the 50% of a population. What the desired effect here? It can reduces the airway resistance. So, the salbutamol, what is the therapeutic effect of a salbutamol? The salbutamol will reduces in the airway resistance. It can decreases the inflammation, it can decreases the congestion, it can decreases the contraction of a muscle. So, here what you have to do here you have to take the 50% of a population, you have to check the toxic dose and you have to check the therapeutic dose, which you can call as a therapeutic index. And what is the importance of a therapeutic index? So, the best important use of the therapeutic index was you can understand what the dose the drug will be the safe and what the dose the drug will be get toxic. So, by knowing of this you can easily prescribe the how much dose you can give to the particular patient. And determination of a therapeutic index. How can you determine the therapeutic index? So, usually you have to determine the therapeutic index by the clinical trials. By the clinical trials, so if you are administering the dose to the clinical trial process, you can understand the therapeutic index. And if I am saying, if I am giving the dose, if I have administered the drug to the particular patient, it had get the therapeutic effect. This is a therapeutic effect. Okay, this is a toxic effect. So, at a therapeutic, so at a desired dose, it can produces the desired effect. As the dose increases, it can produces the toxicity effect. The gap between these two effects you can call as a safety of margin or therapeutic index of a drug. There is a gap between the therapeutic effect of a dose response curve and adverse effects of a dose response curve. You can determine the safety of a drug, which you can call as a therapeutic index of a drug. The lowest level of a drug you can call as an LD50, which I had explained in the previous slide, which you can call as median lethal dose, and lowest dose of a drug you can call as an effective dose, and highest dose of a drug you can call as an lethal dose, which you can call as an LD50. And next one, therapeutic index has been classified into two types depending upon the drugs which be entered into the market. The drugs what we are taking from the market has been categorized into two types. One is the narrow therapeutic index and second one is broad therapeutic index, which you can call as a wider therapeutic index or larger therapeutic index. So, what is the difference between the narrow therapeutic index and the wider therapeutic index? The narrow therapeutic index is a drugs which has been categorized like that, as the slightly increased in the dose will causes the toxicity effect. So, by taking of these drugs you have to keep a keen concentration, because the slightly increase in dose also causes the increase in toxicity. So, there are specific drugs like which comes under narrow therapeutic index was anticoagulants, especially warfarin. Warfarin is an anticoagulant which will falls under narrow therapeutic index. Apart from warfarin, aspirin is also narrow therapeutic index drug. Quinidine, what type of drug it is? Quinidine is an anti-arrhythmic drug. So, it also an a narrow therapeutic index. Theophylline, anti-asthmatic drug, it is also falls under narrow therapeutic index. Phenytoin, anti-epileptic drug. Digoxin, which is used to treat the heart disorder. Which is used to treat the heart failure. So, all these are the drugs will falls under the narrow therapeutic index. If you had increased slightly of a dose like a phenytoin, digoxin, theophylline, quinidine, the slightly increase in dose can causes the increase in toxicity. So, there are some drugs which has been falls in the narrow therapeutic index. And what about the wider therapeutic index? As slightly increase in dose, it cannot produce any toxic effect or any unwanted side effects. So, for example, if you see here penicillin and NSAIDs except aspirin. So, these are the drugs which falls under wider therapeutic index. As the dose increases, there will be no much more toxic effect to the particular drug. Okay. Next, we will discuss about the therapeutic window. So, what is a therapeutic window? Therapeutic window, it will determine the, it is in a ratio. It is a ratio to the minimum effective concentration to the minimum toxic concentration. There is a slight difference between the therapeutic window and therapeutic index. The therapeutic index you can give the ratio to the toxic dose to the effective dose, but in therapeutic window it is a ratio with the effective dose to the toxic concentration. So, what is a therapeutic window? Therapeutic window is a ratio for the minimum effective concentration to the minimum toxic concentration, which you can call as an MEC and MTC. What MEC? Minimum effective concentration, minimum toxic concentration, which will represent the therapeutic window. And next we will move to the combined effect of drugs. So, if you are combining one drug with the next drug, definitely one drug will going to affect the action, or it going to slow down the action, or it going to increase the action, right. When you are taking in a combination of a drug, definitely one drug will alter the action of another drug. Either it can increase the action, either it can decrease the action. Sometimes it will be helpful, sometimes it will causes the harmful, right. So, if I am talking about this combined effect of a drug, this combined effect of a drug has been categorized into two types mainly. One is synergism and second one is antagonism. What is any synergism? Synergism, it will increases the action. One drug is going to increase the action of another drug, then you can call as an synergism. And what is an antagonism? Here one drug is going to inhibit, or it is going to block, or it is going to antagonize the action of an next drug, then you can call as an antagonist drug. Okay. And here the synergistic action of a drug has been again classified into two types, which you can call as an additive and second one is supraadditive. So, one drug is going to add up the action of a second one, just summarize summation. And what about the supraadditive? Supraadditive you can call as a potentiation. One drug is going to potentiate the action of a next drug. Indirectly it will synergist, it will falls under the synergistic action. Here one drug is going to increase the action of another drug. It can call as a synergism, and this synergism has been divided into two types. One is additive and second one is supraadditive. Additive it means summation, supraadditive it means potentiation. And what about the antagonism? Antagonism is further divided into four types. What are the four types here? Physical antagonism, chemical antagonism, receptor antagonism, and finally psychological antagonism. So, what is any psychological antagonism? Here psychological antagonism you can call as a functional antagonism, which I will discuss in coming up slides. And what is about the physical antagonism? By the physical nature the drug is going to antagonize the action of another drug. Chemical antagonism, here by the participation of chemical reaction, here the drug is going to alter the action of another drug, it is going to inhibit the action of another drug. And next one is receptor. The receptor antagonism has been categorized into two types. One is competitive and second one is non-competitive. So, if I am talking about the competitive, what it represents? Here it represents competitive. Here someone is going to compete with another. So, here the antagonist drug will compete with the agonist drug and it will go and bind to the same catalytic site of an agonist drug and it will going to block the action of agonist. So, it is called as a competitive blocker or competitive antagonism. And what about the non-competitive antagonism? Non-competitive antagonism, it non-competitively it will antagonize. So, there is no necessity that the drug have to go and bind to the catalytic site. Apart from the catalytic site, it will go and bind to the rest of the site of any receptor and it going to inhibit the action of that receptor to the particular agonist drug. Okay. So, here this is the classification which we can see here. Combined effect of the drugs, when you had combining the drug one with the another, you can see the synergism or antagonism. Synergism is of two types, additive, supraadditive. And what about the antagonism? It is of physical, chemical, receptor and psychological. We will discuss one by one here. So, what is an advantage of a drug combination? So, if you are giving one drug with another drug, definitely the drug will increases the action of another drug. So, what is the main advantage? If you do not know if the unknown origin of an infection, in such a case the combination of drug will plays a very important role. And what are the disadvantages of a combined effect of a drug? If I taking the first drug, definitely the first drug or the second drug will interfere with each other. For example, if I am taking the tetracycline will interfere, it will interfere the bactericidal action of penicillin. So, here one drug is going to interfere with the action of another drug. So, this is a disadvantage of a combined action. So, now we will discuss about the synergism. What is a synergism? The synergism is mean the action will be get increased or it will be get facilitated by the another drug. So, here the synergism is of two types, one is additive and second one is supraadditive. So, now we will discuss about additive. The additive we can call as a summation. Here if you are taking the drug A and drug B, the effect of drug A plus B is equal to effect of A plus effect of drug B. For example, here I can give you like aspirin. Aspirin, what is the drug? It is aspirin is an NSAIDs drug. Even ibuprofen is also an NSAIDs drug which falls under non-steroidal anti-inflammatory. If you are taking aspirin or if you are taking this NSAIDs with the second NSAIDs like ibuprofen, what is going to show its action? It can causes the analgesic or antipyretic action. So, the one drug here, the one drug is going to increase the action, it is going to facilitate the action of another drug. What is the action here? Analgesic and antipyretic. And the next example was nitrous oxide and halothane. The nitrous oxide and halothane which are used as a general anesthetic drug. So, here these are the examples like amlodipine, propranolol, sulfonylureas, metformin, ephedrine, theophylline, all these are the drugs when you are given in a combination will causes the synergistic action. And here there are the some drugs which will causes the supraadditive action. For example, if I am giving the levodopa drug with the carbidopa drug, the effect of drug A, drug B is greater than the effect of drug A plus effect of drug B. So, here one drug is going to potentiate the action of another drug is called as a supraadditive. And what is an antagonism? Here one drug is going to antagonize the action of another drug. For example, physical antagonism, here the charcoal is a drug which will absorb the alkaloid. It can antagonize the action by the physical nature. It can absorb the alkaloid poisoning. For example, if a particular person having the alkaloid poisoning, the charcoal will absorb the alkaloids, which will it will antagonize the action of alkaloids by the physical antagonism. And what about the chemical antagonism? In chemical antagonism, if you are giving the potassium permanganate will oxidize the alkaloids, and especially it is used in the gastric lavage poison. So, a particular person who we are going to treat with the gastric lavage poison, we will give the potassium permanganate, it will oxidize the alkaloid. Next one, psychological or functional antagonism. What is happening here, students? Here the two different drugs having the two different receptors, two mechanisms, and it will show and it will antagonize the action of each other. For example, if I am talking about the two drugs like histamine and adrenaline, the receptors of histamine is different to that of the receptors with the adrenaline, and the action will be opposite with that of a muscle. So, histamine will causes the bronchial constriction, adrenaline will causes the bronchial relaxation. Histamine will causes the blood pressure dilation, it causes the decrease in blood pressure, and where the adrenaline causes the increase in blood pressure. Receptor antagonism, here the receptor antagonism has been classified into competitive and non-competitive, which I had mentioned in my previous slide. Competitive, it means the agonist will go and bind to the catalytic site and will block the action of an agonist, and non-competitive, it means it will go and bind with the other site of a drug and it will block its action. Thank you.